Bonjour à tous et bienvenue au Symposium Canon des JFR 2024. Donc je pense qu'on peut commencer la session. Donc il y a une petite introduction qui doit être lancée de ce qu'on m'a dit. Ah d'accord. Donc bienvenue au Symposium Canon des JFR 2024. Donc je me présente, je m'appelle Karim Haioun, je suis responsable mondial des collaborations cliniques en R&D chez Canon Medical System et je suis basé au siège monde au Japon. Donc c'est un grand privilège de pouvoir co-modérer cette session aujourd'hui avec la très reconnue professeure Catherine Roy, qui est chef de service au CHU Strasbourg, au NHC. Alors étant donné que la prochaine oratrice fera sa présentation en anglais, permettez-moi de changer de langue et de switcher en anglais pour pouvoir l'introduire et présenter son sujet. Donc pour information, vous avez à disposition des casques qui permettent une traduction en direct. Et pour les autres personnes, vous avez aussi la possibilité, donc il y a un code QR qui va s'afficher sur chaque slide de l'oratrice et à partir du code QR, vous pouvez aussi obtenir une traduction en direct via vos téléphones. So today we will explore an exciting innovation in imaging, the photon counting CT equipped with CZT detectors. So this technology has the potential to push the boundaries of diagnostic precision with unmatched image quality and lower radiation dose, which is, as you know, very crucial for areas like oncologie, where early and accurate diagnosis can play a major role to improve patient outcomes. And now I will let over Professor Roy to introduce our guest speaker. Professor Roy, please.
It's a really great honor and a pleasure to introduce Professor Yuko Nakamura. He is an associate professor in diagnosis radiology in Hiroshima University, of course, in Japan. She brings us an excellent and advanced expertise in radiology, having also conducted advanced and intense research activity in the National Cancer Institute in the US. And today she will share with us her first clinical experience with this new CT machine, a Canon photocounting detector CT, and highlighted its potential to modify and revolutionize the image quality with more characterization and precision. So we look forward to her insight on the potential on the future to transform our clinical practice. Please join me in welcoming Professor Yuko Nakamura.
Good afternoon, everyone. So my name is Yuko Nakamura, a radiologist of Hiroshima University in Japan. So it is great honor for me to have a presentation at JFR 2024. And so I would like to thank the President of JFR 2024 and also the members of Canon Medical Systems for giving me this opportunity. And so regarding COI, our department has a research laboratory collaborated with Canon Medical Systems. So as you know, conventional detector, energy integrating detector EID, uses a scintillator and photodiode method to integrate detected photon signals into electrical signals. And on the other hand, photon counting detector, PCD, directly measures photon energy using a single semiconductor layer. So, however, so although PCD-CT is an interesting and so very hot technology currently, it has been introduced only in a limited number of facilities. And therefore, today, I will talk about technology to improve the performance of EID-CT first. And next, I will talk about our first clinical experience of CZT-based photon counting detector CT. Regarding technology to improve the performance of EID-CT, there are 4 main CT imaging quality parameters, including image noise, spatial resolution, artifacts, and contrast resolution. And regarding image noise and spatial resolution, image noise should be lower, and spatial resolution should be higher for ideal CT image quality. However, the image noise and spatial resolution is in the relationship of trade-off at limited radiation dose. In the Aquilion precision, high-resolution CT features a smaller detector element and tube focus size than conventional CT, indicating that this machine can yield higher spatial resolution images compared with conventional CT scanner. Super resolution deep learning reconstruction (SRDLR) is a new image reconstruction method that yields images with low image noise and high spatial resolution. Using the deep convolutional neural network trained with actual high resolution CT scanner. And SRDLR also has been reported to superior to conventional image reconstruction methods, such as hybrid iterative reconstruction with respect to the image noise and spatial resolution, including the visibility of coronary artery margin or plaque detectability for coronary CT angiography. Therefore, we determine the utility of SRDLR for abdominal CT targeting hepatocellular carcinoma. This is a representative case of hepatocellular carcinoma. And these are dynamic CT images, at arterial phase and equilibrium phase, reconstructed with hybrid iterative reconstruction and SRDLR. Now you can see image noise was lower on SRDLR images compared with hybrid IR images, resulting in the improvement of the image quality. And the row indicates hepatocellular carcinoma. And I will magnify the tumor area. The row indicates the hepatocellular carcinoma again. And tumor was more clearly visualized on SRDLR images compared with hybrid IR images. In addition, the tumor margin, you can see here, it's delineated better on SRDLR images compared with hybrid IR images, because of high spatial resolution, I think. And here are some results. And CNR was significantly higher on SRDLR images compared with hybrid IR images, both arterial phase and equilibrium phase. And regarding subjective image quality scores for HCC, that score was significantly higher on SRDLR images compared with hybrid IR images, both at arterial phase and equilibrium phase. Therefore, we suppose that SRDLR is useful for identification and characterization of HCC, and maybe that this new reconstruction may be a breakthrough technology for conventional abdominal CT. Next, I will talk about our first clinical experience of CZT-based photon counting detector CT. As I talked earlier, photon counting detector directly measures photon energy using a single semiconductor layer. And for photon counting detector, to detect X-rays photons easier, stopping power should be higher. and the detector should be thicker. And high voltage can shorten dead time. And to decrease the generation of scatter rays, detector should be thinner. So this slide shows the CZT photon counting detector, the features of CZT photon counting detector. And CZT photon counting detector has a high stopping power because of high atomic number and high density. And the detector can be seen because of high resistivity. And adding zinc makes the signal stable. And these are pictures of CZT-based photon counting detector CT introduced to our universities last March. This slide shows the details of this machine. And we performed the physical characteristic of PCD-CT first. We compared EID-CT and photon counting detector CT, and so the PCD-CT has two modes, normal resolution mode and super high resolution mode. And this slide shows scanned image parameters for normal resolution mode. And this slide shows scanned image parameters for super high resolution mode. And for super high resolution mode, slice thickness is 0.2 mm, and reconstruction matrix is 1024. And regarding image analysis, using structured phantom for coronary CT angiography here, so we calculated the standard deviation and noise power spectrum, so for the evaluation of image noise characteristic. And for spatial resolution, modulation transfer function MTF was measured. And here are the results for normal resolution mode. And you can see image noise here, the PCD-CT line. So image noise is lower compared with EID-CT. And regarding spatial resolution, MTF of PCD-CT was similar to that of EID-CT. So this result indicating that PCD-CT in normal resolution mode have the possibility to improve the image quality, because of good image noise reduction or reduce radiation dose with maintaining the image quality. This is the results for super high resolution mode, and image noise was higher on PCD-CT compared with EID-CT. However, regarding spatial resolution, MTF of PCD-CT shows higher response compared with EID-CT at all frequencies. Therefore, PCD-CT in super high resolution modes may improve the visualization of small structure because of high spatial resolution. And from now, I will show some clinical cases. These are lung CT images scanned with EID-CT and photon counting detector CT in normal resolution mode of the same patient. Although radiation dose is not same, image quality seems to be better on PCD-CT compared with EID-CT. And these are lung PCD-CT images. The left one was scanned with standard radiation dose. And the right one was scanned with low radiation dose. And you can see image noise increases on the right image because of low radiation dose. However, thank you very much for your kindness, Professor. Sorry.
So let's give a few seconds to drink.
Okay, I will stop. But the image quality of the right image seems to be sufficient clinically. And these are lung HRCT images of the same patient. And as before, the right image, so image noise increases, but so the quality so seems to be sufficient so the clinically. And these are lung PCD CT images. So the left one so is normal resolution mode image, and the right one so is super high resolution mode image. It is kind of difficult to detect the difference so between these images. But how about coronal MIP images? So you can see pulmonary vasculature, especially at peripheral area, is visualized better on SHR mode image compared with normal resolution mode image. And these are ear oscillatory photon counting detector CT images, so in normal resolution mode and SHR mode. And you can see the small structure here is visualized better on SHR mode image compared with normal resolution mode image. And these are 3D images, so that you can see the small structure here, so is visualized better on SHR mode image compared with normal resolution mode image. And these are knee CT images scanned with EID CT and photon counting detector, so in super high resolution mode. And you can see the bone, the content of the bone, so the trabeculus, so it's very nicely visualized on SHR mode image compared with EID CT. And these are 3D images. So the difference between EID CT and photon counting detector CT so is also evident, I think. And these are abdominal contrast enhanced CT, so scanned with EID CT and photon counting detector CT in normal resolution mode. So actually, MM modulation cannot be applied to the current version of photon counting detector CT. So therefore, radiation dose is not the same. But the image quality of photon counting detector CT seems to be superior compared to EID CT because of low image noise and better contrast. And we found that the quality of non-contrast abdominal CT is superior on PCD CT image compared with EID CT images. Therefore, we evaluated the difference between EID and PCD CT with matching the radiation dose. And here are some results. Image noise was significantly lower on PCD CT images compared with EID CT images. And regarding subjective image quality scores for sharpness of liver edge and visibility of intrahepatic vessels, although there was no significant difference between EID CT and PCD CT, however, the score for PCD CT tended to be higher on PCD CT compared with EID CT images. And the overall image quality scores of PCD CT was significantly higher compared with EID CT. Maybe because of the good image noise reduction. Therefore, we suppose that the PCD CT has the possibility to improve the image quality of non-contrast abdominal CT. And the deep learning reconstruction can improve the quality of CT images. And DLR can be applied to PCD CT in super high resolution mode. And these are lung photon counting detector CT images in super high resolution mode, reconstructed with hybrid iterative reconstruction and deep learning reconstruction. You can see the DLR can reduce image noise with maintaining the visualization of small structures. And DLR is also useful to improve the quality of low radiation dose images, like this. And for abdominal CT, these are the drip infusion cholangiography acquired with CT. And the left one is the normal resolution mode, and the right one is super high resolution mode. And both of them are reconstructed with hybrid iterative reconstruction. And you can see the bile duct visualization, especially at the peripheral area, is better on SHR mode image compared with normal resolution mode image. However, image noise increases on the right image compared with the left image. And DLR can reduce the image noise effectively and with maintaining the visualization of the bile duct. And the increment of image noise on high spatial resolution images, SHR mode image, is problematic, especially at abdominal CT. And DLR is also useful for such cases. Finally, the spectral analysis, including virtual monochromatic images, virtual non-contrast images, and iodine maps can be generated with photon counting detector CT, like EID-based dual energy CT. And PCD-CT is expected to yield more accurate spectral analysis because of better energy separation compared with EID-based dual energy CT. And however, these images are reconstructed with hybrid iterative reconstruction, that there are some noise, especially at local images also on iodine maps. And DLR can be applied to spectral analysis images, and can reduce image noise effectively. These are the same case, you can see some noise on low-gauge virtual monochromatic images and also on iodine maps with reconstructed with hybrid iterative reconstruction. But the DLR can reduce the image noise on such images and improve the image quality. Taken together, the possibility of photon counting detector CT can be improved further in combination with deep learning reconstruction. To sum up today's my talk, the image noise and spatial resolution is in the relationship of trade-off at limited radiation dose. The super resolution deep learning reconstruction, SRDLR, is a new image reconstruction method using a deep convolutional neural network trained on actual high resolution CT scanner. And SRDLR can improve quantitatively and qualitatively image quality of abdominal CT for evaluation of hepatocellular carcinoma, and it may be a breakthrough technology for conventional abdominal CT. The CZT-based photon counting detector has a high stopping power and high voltage can be applied. The addition of zinc can increase stability. In a normal resolution mode of CZT-based photon counting detector CT can reduce image noise, and its super high resolution mode provides high spatial resolution images. And deep learning reconstruction can contribute to improving the quality of SHR mode images and also the spectral analysis of PCD-CT. Finally, I will express my gratitude to Professor Y and all staffs of Diagnostic Radiology of Hiroshima University, and also members of Canon Medical Systems who support me very much. And thank you very much for your kind introductions, Professor Over and Mr. Haioun. And thank you very much for your attention, and merci beaucoup.
Thank you very much, Professor Nakamura, for your excellent presentation and for sharing your first experience on CZT-based Canon photon counting detector. So I think we have 5 minutes for taking some questions. So is there any question from the attendees? So maybe waiting some question from the attendees. Professor Nakamura, maybe I have one question on your first part regarding the new super resolution deep learning reconstruction about PIC 1024 matrix. So you showed very nice clinical example of HCC, providing high contrast noise ratio and the ability also to detect subtle change in contrast. So what is your opinion? How do you think this new technology will impact diagnostic performance for HCC in clinical practice in the future?
Thank you very much for your question. I think the it is important for diagnosis of HCC, so to evaluate so the tumor so shape or tumor morphology. So because so the tumor morphology so is different so the according so to the aggressiveness. So for example, so the HCC with irregular margins, so it's more aggressive compared to the HCC so with smooth so margin. So therefore, so the but so the spatial resolution so of conventional CT is limited. So therefore, so we cannot so evaluate so the detail of the tumor so morphology. And so SRDLR so that can improve the spatial resolution. So that I think so that it may be a good so the technology so for evaluation of the tumor morphology. So the precisely so it is so the clinically it has a clinical impact, I think.
Thank you very much for your answer.
Is there any other comments or questions about this new aspect of the CT? No. Let me ask you another question. What do you think about the DLR capability with ultra-resolution mode on this type of new CT machine to improve the lesion characterization compared to the conventional CT, and with a focus on a big issue we have in our routine clinic, meaning that to differentiate a benign from a malignant tumoral process?
Thank you very much for your question, Professor. And so like so the super SRDLR, so the images with high spatial resolution and low image noise so is ideal so for abdominal CT. And I think so the more precise so the evaluation of tumor so can be so the achieved with so such images. Therefore, so actually so the currently I don't so have such experiments, so but so the diagnostic ability so the for differentiation so the between benign and malignant lesions so maybe improved, so I hope, and I want to so determine so this point so in future. Thank you very much.
Yes, it's a big issue and perhaps we can solve it in the near future, but I don't know. Is there any other comments or?
Y a-t-il des questions dans la salle? Ne soyez pas timide. Hein. Je vais terminer juste par une dernière question. So, Professor Nakamura, maybe this is the last question of the session. You conclude your presentation with very nice images, combining spectral imaging, but with DLR on PCCT. So, what is your vision? What are the key future clinical applications you think this combination of spectral imaging combined with DLR can be impactful? For example, in France and Europe, there is a trend, some pressure on contrast media. Of course, there is some patients with bad kidney failure, but also sometimes there is a shortage of contrast media or price also increase, etc. So what do you think?
So, so like their energy, so their IID-based their energy CT, so they're using PCD-CT, so the virtual monochromatic so images so can be generated. So, and so, so the contrast dose so that can be reduced with low Kev, so the virtual monochromatic images. So because so that it increases the contrast so derived from iodine. And so also, so the image noise increases at lower so Kev images. Therefore, and the DLR so can reduce image noise so the at lower Kev images, I think. So therefore, the combination so with the low Kev images, lower Kev images, and DLR so it's a very so the important meaning so the in the clinical settings because of the improvement of the image quality of low Kev images.
Thank you very much. Merci beaucoup. So I think it's time, Professor Roy. So if there's no other question, we would like to conclude and close the session. I would like to thank, I think we can thank again very much Professor Nakamura. She's coming from Japan, far away. So thank you very much, Professor Nakamura. Again. And thank you, Professor Wa, for being the chairman, and thanks for all organizer. So thank you and goodbye. Merci. Au revoir.
Thank you.